As coronavirus cases keep going down and more shots get to more people, that hopeful light is getting just a little bit brighter. But we know that the questions keep coming, especially as we get closer to hitting the year mark of when the pandemic started. So that's why tonight we're checking in with a local hospital to see how things are going, where we are with vaccine distribution, priority groups and allocation, and everything in between. As we work to get your questions answered, we together, a coronavirus discussion.
And thanks for joining us tonight for our special I'm Molly Pat. For months now, we've been asking you to email us all of your questions on all things coronavirus. And week after week, the emails and phone calls roll in of what exactly you want to know. So tonight, I'm joined by Cliff Jones from Stormont, Vail, and Amy Kripe, who is a nursing manager at the hospital on one of the coronavirus floors, to answer all of your questions. So thank you both for being here tonight. Now, before we get to the Q&A, I want to give a quick update on what we're seeing in Kansas right now. On the vaccine front, the state reports more than 805,000 doses have been distributed across Kansas, which means compared to last week, there are about 205,000 more vaccines in the state just from 7 days ago. More than 584,000 vaccines have been administered in Kansas, including both first and second doses. That's an additional 101,000 since last Monday. The state says in total, more than 393,000 people in the state have been given their first dose at least. And today, good news, a new vaccine being shipped out. Here's a look at one of the boxes at Johnson & Johnson as it's getting a very special send-off today. This is in Kentucky at the warehouse, being shipped off with cheers and applause. The FDA granted emergency use authorization for the J&J vaccine over the weekend. Data shows the one-dose shot is 85% effective against the most serious COVID-19 infection. It was also 100% effective in preventing COVID-19 deaths. Johnson & Johnson plans to deliver 4 million doses this week across the country and 20 million by the end of the month. So with that, we want to get right to it. Dr. Jones, have you heard anything about getting the Johnson & Johnson vaccine to Stormont, Vail?
I have not heard. Again, I am assuming that with 4 million vaccine doses distributed across the country, Kansas will get some allotment, and as with the Moderna and the Pfizer allotments, they'll go through our Kansas State Department of Health and Environment and then be distributed to the counties. So I don't know when we'll get ours, but I'm sure we'll be hearing about that soon.
Yeah, and with the three choices, or not choices, with the three vaccines, do people have a choice about what vaccine they can get, or should they really just take whatever is available to them?
I strongly encourage people, when they're eligible to get the vaccine based on what phase we're in and vaccination access, they should get that vaccine. There'll obviously be some people that want to wait, and that's up to them. The Johnson & Johnson vaccine will likely have a different kind of distribution because it doesn't require the ultra-cold freezer storage. It has a refrigerated shelf life that will allow it to be distributed to other kinds of facilities. So I think people should get what is available to them as soon as it's available to them.
Yeah, definitely. And as another week goes by, just to check in, how is vaccine rollout going at the hospital?
Again, I have an observational bias, and I know how we've done, and I know it's been a huge undertaking. I think, as many people know, we were able to participate with the County Health Department, with St. Francis, in providing vaccinations for the K through 12 educators. That went very well, and I know we're back at the phase 2 vaccination of the individuals 65 years of age and older now.
Yeah. All right, Amy, you work on one of the coronavirus floors at Stormont. So as we get closer to that year mark of when the pandemic started, how is morale and how is your staff holding up?
You know, it's been a very difficult year and something that none of us expected. My unit a year ago was a post-surgical unit. So in a matter of days, it was converted to a COVID unit, and there was a lot of unknowns and a lot of scary times. We've learned a lot over the last year. We've really leaned on each other and the support of people around us to get through this last year.
Yeah, it's definitely crazy to think that it is already March and a year has gone by. Now, a viewer question, Norman Johnson wants to know, can you tell us exactly what is in the experimental vaccine that is now being administered to Americans? Dr. Jones, can I have you talk about what's in the vaccines and then the research that was done to make them get emergency use authorization?
So all three vaccines have been released under emergency use authorization. So they're beyond the experimental phase. These are vaccines that have been trialed and proven through very large, fairly vast phase 3 studies. And obviously millions and millions of doses of the first two vaccines have already been given. All three stimulate our bodies to produce antibodies to the viral spike protein from the COVID-19. They do it in different ways. The Moderna and the Pfizer vaccines that came out in December use messenger RNA that is provided and is a stimulant to our cells to produce markers on those cells that subsequently we form antibodies to. The antibodies to the spike protein, which is the invasive protein that the COVID-19 virus has. The Johnson & Johnson vaccine uses a different technique. It uses a viral vector. It's an adenovirus that's been modified so it can't replicate itself, but it does also have a modification similar, I guess, to the Pfizer and the Moderna vaccine to stimulate our cells to produce a spike protein protuberance that antibodies will be trained to attack. So both of them kind of work in the same fashion.
And Amy, one viewer wants to know if there are any medications that could cause a problem for a person when getting a shot. What do you recommend people do if they have to take any Advil, ibuprofen, aspirin, or any prescription as well before?
I think a lot of people have had just some natural side effects from the vaccines, and so it's very common for people to need some over-the-counter Tylenol or ibuprofen to help with those muscle aches and sore arms and things like that after the fact.
And Dr. Jones, Sandy Hartman says, my husband and I have both received both of our coronavirus shots. I thought that we were going to receive a card with the information on there showing that we had received the shots, the date, the lot number, our names, etc., but we did not. It is a concern that sometime we will need them for travel to show proof that we have gotten the shots. Will those be available to get at some time to all? I can look on my chart for the record, but can I print off a card there? So I want you to talk about, can people get copies of those cards if they didn't get it when they actually got their shot, and why is it important to get one of those?
So I am aware that we've had individuals ask for cards, and we have been able to supply them. All the data on the immunization that people receive is stored electronically. In Kansas, it's through WebIZ, and that's accessible through your own medical record. If you have my chart, you can print a document, you can show a facsimile of the document. It basically, in the setting of the large-scale vaccination clinics that we set up, the addition of additional steps to create those vaccine cards that the CDC has provided would have added another impediment and taken significantly greater time in processing the individuals that were going through for vaccination. So it is available electronically. You should be able to receive a vaccine card if you desire one.
Awesome. And Amy, how is it with your staff? How are people doing being at those vaccination clinics, and has that changed nursing at all through the pandemic? Are you guys getting different, duties throughout the day, something like a vaccination clinic?
So my specific unit, no. My nurses are staying at the bedside working on my floor, but there have been a lot of opportunities for staff all over Stormont and Cotton O'Neill to pick up shifts at the vaccination clinic. That's been offered to my staff, and I do have some that have taken shifts there. So I think it's a different way to help during this pandemic, and it's been a great thing for people to be able to do.
Absolutely. And Dr. Jones, Steve Hare, for our final question in this little segment here, he says that he's a little confused regarding how to get a vaccine in Shawnee County. He wants to know if the doses coming to Shawnee County go to the health department and then are distributed between hospitals, Walmart, and Walgreens, for example. Can you walk us through that process of how you get vaccine allocations and then how people can sign up to get a vaccine at Stormont Vail, what that looks like for them?
The state allocation is subsequently distributed under the directions in Shawnee County, the Shawnee County Health Department, as far as how many available doses from that allocation go to, for example, Stormont Vail or St. Francis. Separate distributions have been made available to pharmacies, and again, they have limited numbers of doses, but they'll continue to receive doses on an ongoing basis, and I am absolutely certain that their internet sites have instructions on how to sign up for those doses. With the allocation that Stormont Vail has, we're still following the guidelines, the state guidelines, and we're limiting to phase 2, so that's individuals 65 years of age and older. If you are an individual 65 years of age or older and you are a Cotton O'Neill or Stormont patient and you have set up a MyChart account, you should get notification and you should be able to sign up and schedule a dose based on that eligibility through MyChart. You can do it electronically. If you do not have a MyChart account, if you're not a current or past patient of Cotton O'Neill or Stormont Vail, you can find this phone number on the internet, on the website, the stormontvail.org website under the COVID-19 vaccine, or you can write this down. It's area code 785-270-0644, and you'll talk to a live person. I don't know how many of those live people are there standing by ready for a call. They're not really standing by, so I can't make any promises on how long you'd be waiting. But you will be able to talk to a live person and arrange and schedule a vaccine account, vaccine schedule in the coming weeks.
Yeah, that definitely helps people out, especially if they, aren't familiar with technology and can't get on the MyChart for sure. All right, we're going to take a quick break here, but coming up next, we're going to talk about how safe the vaccine is, getting tested for coronavirus, and much more. We'll be right back.
We Together, a coronavirus discussion sponsored by Stormont Vail Health.
Footprints, your Birkenstock store. 3,000 pair in stock, complete repair shop, selection available at footprints.com. 1339 Massachusetts Street in Lawrence.
Frontliners, essential employees, heroes. We've been called many things during this pandemic, but the truth is, we aren't your first line of defense. That title belongs to you, your neighbors, and your community. By wearing a mask, washing your hands, and social distancing, you can keep us safe. Care for others, so we can care for you. Stormont Vail Health, empowering you together.
COVID-19. Will I get it? Will I survive? COVID is scary, but there's one place you should always feel safe. At Stormont Vail Health, our hospital and clinics are taking every precaution to make sure you can still receive your routine and elective health care quickly and safely. Our emergency department with a level 2 trauma center is still the best place for emergent care. COVID-19 is scary, but receiving your health care shouldn't be.
I care about you still so much.
Tonight, Matt faces the women he sent home.
I really thought I was going to meet your family. Is it me?
And it all leads.
I am very much in love. I'm completely in love with you. I'm so in love with you.
I don't know. Is love enough?
To the heart-stopping.
Am I ready to make that commitment?
Bachelor season finale.
Can I get there? What's the right thing to do?
The Bachelor, new tonight on ABC.
Footprints, your Birkenstock store. 3,000 pair in stock, complete repair shop, selection available at footprints.com. 1339 Massachusetts Street in Lawrence.
Welcome back to our coronavirus special discussion. We're going to get right back to it because we have a lot of questions still tonight. So Amy, this question comes from George Bales. He wants to know, if we don't have any symptoms of coronavirus, do we need to get tested? I've also seen a lot of information saying that 90% of all positive tests are false positives. So can you talk about when to get tested for COVID-19 and then any information about false positive tests?
So we have a hotline that we direct everybody to call if they have symptoms of coronavirus. And I believe they're testing if you have more than 2 symptoms. Then they would direct you to go to the drive-through testing clinic to get tested. I don't know about the false positive test, so I'm not sure if Dr. Jones has any information on that.
Dr. Jones, do you know anything about information about false positives that we've been going through in this pandemic?
I think the test is highly accurate. So there is some cases where the test may be falsely negative if people are tested too early, especially with the antigen tests, but the molecular tests or the PCR tests are highly specific. So we feel that it's as close to about 100% true positive when it is positive.
And then on that note, he also wants to know which coronavirus test is better, the nasal swab or the mouth test, and what one were you talking about? Is that through the nose or is that through the mouth?
So the molecular test, the PCR test, historically have been chiefly performed with nasopharyngeal swabbing. There is data under the right circumstances and with an appropriate collected specimen that a saliva test can be performed. It's also a molecular test. There are nose swabs that are antigen tests that are more quickly performed. Those are often what they call point of care tests, where the results are available immediately. When those are positive, they're predictive of an accurate result. They can be falsely negative, especially early in infection.
Okay, and so Amy, there are still a lot of naysayers not only to the vaccine but also to the virus itself. So what would you say to those people, especially with all that you've seen working in the COVID unit throughout the last year?
It's definitely not fake. We've seen a lot of patients who are very, very sick from the coronavirus. And so I can say that it's real. It's a real thing. We've seen a lot of patients that have had it and have been really sick from it. So it is a serious thing, and if you have symptoms, we would refer you to get tested.
And Dr. Jones, Vina Gardner-Leith wants to know, will we need this vaccine yearly like the flu shot, and will it also be a two-part shot if we do need it year after year?
I can't answer the questions with certainty. I am suspecting that we will have an annual shot, a COVID-19 shot to provide continued immunity. I would expect that as the technology and the science increases and improves, a booster would be a one-time shot. That's what I would predict.
Okay, and then speaking of the flu, I want to go over this one again this week. Why are we not seeing a flu this year? Do you think that it will come back next year for us?
Clearly, this is the most amazing influenza season that any of us have ever seen. Virtually zero cases, and we are testing for it. We have viral panels that include influenza in the test. Never seen anything like this. Lots of theories. The decrease in international travel, so exchange between the southern hemisphere. Their flu season was our summer. Our flu season is their summer. So is international travel curtailment playing a role? I have no doubt that even though people have been reluctant to embrace social distancing and mask wearing and hand washing, way more of that has been done over the last 12 months than has ever been performed in my career or my observation just as a human being. So I know that's helped an awful lot.
Yeah, do you think that because that's helped through this flu season, which is really non-existent flu season, will we be wearing the masks and social distancing, in years to come during flu season as a way to kind of keep it away?
I, again, think that might not be a bad idea. I don't know that it will be widely accepted. I know lots of countries in Asia, there's been a habit, probably it dates back to the original SARS epidemic, where people got in the habit during the respiratory viral season of wearing masks when they were unable to maintain distance, when they were, for example, in airplane cabins or waiting in lines in mass events. So maybe we'll see that. None of us really are excited about that future, but it's been an amazing year as far as common colds and everything else, just the amount of protection that some common sense and a lot of hand washing can do.
Yeah, and Amy, can you talk about your team with the flu season? You guys gear up and get ready for it year after year, and then, what's everybody saying about it now? It's not here, but it's also kind of overpowered, obviously, by coronavirus. What's your team think about that?
Yeah, I agree with Dr. Jones that the hand washing and social distancing and mask wearing have definitely helped to prevent the flu this year. And I think, my team has been really focused on the COVID patients. And so I don't know that we would have seen a lot of flu patients on my unit anyway, because we were full of COVID patients. So that's really been our focus.
Yeah, and then can you also talk about some of the side effects that you're seeing most often come from the shot, Amy? And is there any that's been really surprising to you, any side effects?
The most common side effects that we have been hearing about are, of course, the sore arm. That's the number one side effect that I hear. And then a lot of muscle soreness. Some people have ran a low-grade fever, 24 hours after getting their vaccine. Muscle aches, just generally not feeling well. Some nausea, things like that.
All right, we're going to take another quick break here, but when we come back, we're going to answer more of your questions and even talk about other variants of coronavirus. We'll be right back.
We Together, a coronavirus discussion sponsored by Stormont Vail Health.
High pressure.
And so overwhelming.
Furniture and mattress shopping shouldn't be difficult. Enjoy grand opening savings, plus the most fun and easy furniture experience on the planet at the Furniture Mall of Kansas. Oh yeah!
Stormont Vail Health, Heartland Healthy Neighborhood, and the Shawnee County Health Department need your input. As part of the Community Health Needs Assessment for the residents of Shawnee County, an online survey is available for you to provide feedback about the health needs affecting you and your family. The survey takes less than 10 minutes to complete. All responses are confidential. Help us meet the needs of those in our community. Stormont Vail Health, Heartland Healthy Neighborhood y el Departamento de Salud de Shawnee County necesitan su ayuda. Estamos ofreciendo una encuesta digital que nos ayudará a entender cuáles son las necesidades de salud suyas y de su familia. Esto es parte de un asesoramiento de necesidades médicas y de salud para los residentes del condado de Shawnee. La encuesta toma menos de 10 minutos y todas las respuestas son confidenciales. Ayúdenos a cuidar de las necesidades de salud de todos en la comunidad.
For the latest school closings in your area, download the free KSNT News or Storm Track weather app today. Available at your mobile marketplace.
High pressure.
And so overwhelming.
Furniture and mattress shopping shouldn't be difficult. Enjoy grand opening savings, plus the most fun and easy furniture experience on the planet at the Furniture Mall of Kansas. Oh yeah!
We are back for our final few minutes in tonight's coronavirus special. So Dr. Jones, Deanna Williamson wants to know, who is the priority group right now for getting the vaccine at Stormont Vail? We know that you've been taking it by an even more specific age group than really what the state is recommending for appointments 65 and older. You've been doing 71-year-olds and then 68-year-olds. So what does that mean for what's to come next? Now we know you're taking all 65 and older.
That's exactly where it is. So until the state instructions are to move beyond the phase 2. The next phase, to my understanding, would be individuals with underlying health problems, chronic disease, for example. But up until that point, we're going to continue with 65 and over. We're no longer working our way down from 75, which is how we started, but 65 and up are eligible for vaccination.
That's good. That's good news there. And Amy, the visitor policy is also changing at the hospital to allow 2 visitors now. First, what difference will that make for patients that you've seen? And does that also give your team a little bit a sense of hope that things are really moving in the right direction?
Yeah, I think overall the numbers that we've seen over the last few weeks have really given my team and I think everybody at Stormont hope that things are improving. And I think also the change in our visitor policy to allow 2 designated visitors for patients who are not in isolation is also bringing hope to people, because that allows for more support for them while they're in the hospital and to not feel so isolated.
Yeah, definitely good to see. Now, Dr. Jones, 8 new cases of the UK variant have been identified in Sedgwick County. Is that concerning at all to you?
Well, it is not surprising. It's been predicted that in the United States that by the end of the month of March that the Great Britain strain may be the most common strain that we isolate. So it's been predicted that if there is a surge, and it seems likely at some point that we'll have some surge in cases, it would be with these variants. So yes, Kansas I think has had a total of 8 or 10 total cases. 8 more were reported earlier this week.
Yeah. And how do you prepare your staff for these new variants, or do you kind of just continue as normal? What's that process look like?
I think it's kind of hammers home the message that we've been receiving from national leaders, state leaders, and also within our organization, that we're not through this. We're used to wearing these masks and washing our hands and keeping distance and avoiding crowds when it's possible. We need to continue to protect ourselves. It's worked. Not infallibly, but it's worked throughout the 11.5 months that we've been dealing with this to protect us and protect our patients. So we'll just have to carry on. We don't see an end in the need to take these simple precautions in the near future.
And do you think that patients will be treated in the same way, whether they get the different variants or if they're getting COVID-19 itself?
No, absolutely. It's still COVID-19. The virus has been mutating since it was discovered late in 2019. And again, the strain that was initially established on the west coast of the United States was an Asian strain. The strain that was established on the east coast was more similar to the strain circulating in Italy. So that's happened throughout the pandemic, and it's going to be expected that it will continue to go. That, again, dating back to the beginning. The illness is the same. The contagiousness may be different, and that may reflect some subtle variance in immunity. If individuals have immunity to the COVID-19 virus that they were initially infected with, are they going to have the same level of immunity to a variant? I guess we don't really know. It's expected that there'll be at least partial protection. There's questions about the vaccine efficacy. It appears to be effective in parts of the world where they have predominant infection with these variants as far as protecting from severe illness. And again, that's an expectation that will hold until it's proven otherwise.
And Amy, with these new variants coming out, it can cause some concern. So what do you think that we need to do to keep things moving in the right direction, especially as this starts coming to light? Obviously, we know wearing our mask and washing our hands is great, and that's what we need to keep doing. But is there anything else that we really shouldn't let up on to keep things where they're at right now?
I think we just continue to follow the same guidelines that we've been following since the beginning with the social distancing and hand washing and mask wearing. I think that's really what we all need to focus on.
And Dr. Jones, Mary Holiday wants to know, as we get closer to entering phase 3 in Shawnee County, which would be people 16 to 64 with medical risks and other critical workers, will the vaccine distribution process look the same through the MyChart app? Obviously that population is going to be much, much bigger, so it's going to take a little bit longer. Have you guys discussed that route of how to get those people in appointments?
It's been studied and prepared for weeks, if not longer. I guess I have some confidence that we've gotten good enough at this over the last 2 months of treating the individuals that we have included that we'll have this figured out. So I think the best way to schedule a vaccine when it's been announced that we're entering phase 3 and individuals with underlying health issues are eligible would be through your provider's office, or if you have MyChart, through that application.
And then Amy, is there anything that people can do to help your team and your staff right now? It's been a long, long year, especially working on a COVID unit. Us on the outside, we can only imagine what you all have been going through. So is there anything that people can do to really help you guys out?
We have had a huge outpouring of community support throughout the last year. Lots of people sending in treats and cards and thoughts and prayers. And so I would just ask that continues, and also to just continue to follow the guidelines so we can keep moving in the right direction.
And Dr. Jones, in one sentence, if you want people to take away just one thing tonight, what would it be?
Things are getting better right now as far as the load of infection that's in the community. Keep our eyes open and keep educated as to the trends, and expectation that this will either taper down completely or taper off. There'll be surges, but we'll be able to handle them as they come.
All right. Thank you both so much for taking the time to answer our questions tonight. We really appreciate it. And thank you for watching. We appreciate you sending in all of your questions as well. So keep sending them in. If we didn't get to your question tonight, don't worry. I am personally reading through all of those questions and the emails. So send them to coronavirus@ksnt.com. You can also message them on Facebook to us. Have a good night.
Frontliners, essential employees, heroes. We've been called many things during this pandemic, but the truth is, we aren't your first line of defense. That title belongs to you, your neighbors, and your community. By wearing a mask, washing your hands, and social distancing, you can keep us safe. Care for others, so we can care for you. Stormont Vail Health, empowering you together.
COVID-19. Will I get it? Will I survive? COVID is scary, but there's one place you should always feel safe. At Stormont Vail Health, our hospital and clinics are taking every precaution to make sure you can still receive your routine and elective health care quickly and safely. Our emergency department with a level 2 trauma center is still the best place for emergent care. COVID-19 is scary, but receiving your health care shouldn't be.